did it together.
Right. And so let's just, when we get to your group, let's see how it goes. Let's see what you can remember and let's see what you can contribute, but it'll be fine. My point in mentioning the presentations was it was an excellent opportunity for everybody to hear other presentations. And then at the end, we talked a little bit about group dynamics, you know, what works, what doesn't work, and how in nursing, you're always going to be part of a group or a team. And how do you handle conflict? How do you do that? So we'll talk about that. Okay. Does anybody have any questions? Hi, Terry. Okay, so let's start. I'm going to share my screen. Let's start with these little pre-tests. So what I did is I went into the book. All you're reading this week is from your Med-Surg book, right? Okay, so what I did was went into the book and looked at the pages, you know, looked at what was covered in the pages. And then I pulled up that particular chapter. Like, for example, there were a couple of full chapters, I think chapter 5 and chapter 9. When you looked at the pages you need to read, it was actually the whole chapter. So I pulled up both of those pre-tests. And then with the other chapters, 30, 18, and 37, it was only a few pages in the chapter. So I pulled out a couple of questions from the kind of pre-test. And I don't mean to use the word test, but it's a good indicator of what you know, and what you need to study. Okay. So that's for this week. All right. So let's start with that. I'm going to start with chapter 30. So in these are chapter pre-tests. Have students answer the questions prior to covering this chapter to understand where they stand in relation to the content. So this was talking about chapter 30. Oh, I need to share my screen. Sorry about that. Okay. Okay, can you see that? Everybody see that? So I really want this to be interactive. So chapter 30, the only thing we covered in chapter 30 was, who knows what we covered in chapter 30 from your readings? We covered cirrhosis, right? You guys remember that? We didn't cover the whole chapter. We just covered cirrhosis. All right, so you look at your readings, it was, let's see, page 726 to 730. So I pulled out a couple of questions that had to do with cirrhosis. We don't need to do the whole pre-test because you're not doing the whole chapter. So let's answer these. Let's see how well you got. If you did your reading, you should be able to answer this, but this is a good starting exercise for the kinds of questions that you're going to get either on your exam or on NCLEX or on HESI. So they're good practice questions and they come from Elsevier. So what do you guys think for number 6? And I need people to participate. So what do you guys think?
I want to say B or D.
B or D?
Yeah, I was thinking B or D too.
Okay. Okay. Anybody else have any different? The answer is B. Okay. Abdominal girth is for sure, but for patients with ascites, you have to do a daily weight. Okay. So the answer is B. Okay. What about number 7? What is classic? I mean, even if there's a lot of words in these 4 answers, what is classic with cirrhosis? Classic.
Edema.
Even more classic than
Jaundice.
that. Jaundice. When you think of cirrhosis, don't you think of jaundice?
Yes.
That's a given. Okay, that's a given. Everything else may affect this patient, may affect that patient, but jaundice is a given. So
So A.
So A, right? So let's say you get into this question and said, oh gosh, that's a lot. I have no idea, but I know jaundice is the most common denominator in cirrhosis. That's an easy answer, A, right? Because there's no jaundice in any other answers. Okay. So read up on your, so cirrhosis. So I compared the notes, your week 8 notes, to the readings, and the week 8 notes are an excellent summary of your readings. I'm not saying no, don't do your readings, but start with your notes. Okay, so when we get to the notes, we're going to review that next. You'll see that these questions, this information to answer these questions is in your notes. So if you haven't reviewed your week 8 notes, you may not know a lot of these answers. Okay. Make sense? Okay. So that's just kind of a let's see. Let's go to week 9. Okay. So week 9, when you look at the reading, it's from 182 to 197, which is pretty much the whole chapter. So let's see how you do on this. All right. So chronic illness and rehab. All right. So read number 1. I want you guys to answer these out loud. This is helping you. What's a chronic illness?
D.
Okay. Everybody agree with that?
Yes.
Okay, that's the correct answer. Okay, read number 2. What's the correct answer? And what word in the question do you have to pull out?
Most.
Most. Great. Okay, so now you're looking for a most. It's a priority question. What do you guys think?
I
C.
would say
Is it
C.
C?
C.
Yep. Yep. All of the answers could apply if it didn't say most, right? But when you add most in there, you have to pick the most severe or the most at risk, which would be C. You understand how to read that question? Okay. You got to be able to catch those words, those priority words. Okay. Okay, let's do number 3. And again, this is all in your readings. So if you haven't reviewed it, you may not know the answers. So, but that's why I want to go through it to see where we're at. What's the answer?
A.
It really would be helpful. This is going through these questions is for your knowledge and education. Really helpful if everybody jumped in and participated. Okay. I heard A. Does
I
anybody
agree.
concur
think
with
it's
I
A?
agree with
or-
A too.
A.
Okay. Okay. A is the correct answer. Okay. What about number 4?
B.
Anybody else agree with B or have
I
another
agree with B
answer?
too. Yes, I agree with B.
B.
Okay. B is the correct answer. Okay. Number 5. So when you think of this question, think of like restraints.
D.
D.
Why?
D.
Why is the answer D?
Because you don't want to restrain the patients unless you absolutely have to.
Yep. Does everybody understand that? Okay. Yep. The answer is D.
Yep, the answer.
What about number 6? It's healthy people. Goals for rehabilitation. That's in your chapter. So if you haven't read your chapter, you probably won't know this. Okay. So anybody have a stab at it? They're talking about rehab. So it's people with disabilities. Okay, and it's specific to Healthy People 2020. So this is the answer. So you'd have to read that Healthy People 2020 box for this chapter to understand what their objective is, and that's their objective.
See, I was stuck between A and C because I feel like those are pretty similar.
Mm-hmm. Yep. Okay, and when we ask Healthy People 2020 questions, we're looking straight up from that information in the chapter. There is a little a chart in each chapter that talks about Healthy People 2020 objectives. So that would be the Healthy People 2020 objective. Okay. Okay, so what about number 7? D is down on the next page.
Would it be C?
C is not the correct answer.
Is it B?
B or D?
D as in dog.
It
D.
is D. Why is it D? Why do we think it's D?
I honestly have no idea.
Remember, it's respiratory rehabilitation. So they may or may not be ordered medication. But if they are ordered inhaled medication, which they probably will be, you have to make sure that they know how to use it correctly. Otherwise, it's not going to work, right? Does everybody understand that? Okay. This is a select all that apply. Number 8. This is your role in the rehab care. Does A sound like a good answer? Working in collaboration with the RN?
Yes.
Okay, that's 1. How does B sound? Assisting with the patient and family education. Do we do that?
Yes.
Yeah, of course.
Yeah, we do
That's a
that.
big part of our job, right? So B is correct. What about actively participating and facilitating learning experiences? Is that part of what you do?
Yes.
Yep. What about D, being the person in charge of the rehab team and determining the plan of care?
No.
No.
Why is that incorrect?
Why is that? Unfortunately, LPNs can't take control.
So A, B, and C are correct. D is incorrect. Okay. This is also in your reading. Minimum data set screening is necessary for reimbursement. In which type of care? If you haven't done the readings, you're not going to know this yet. But maybe you could maybe you could limit the answers that possibly are correct. What is this chapter about? Chronic illness and rehabilitation. So knowing that, what might be the correct answer if you have no idea?
C.
B.
C as in cat.
Nope, C's not the right answer. Try again.
B. Maybe
Why would it be B? Well, what is this chapter about?
the like rehabs and the chronic
Lo-
illnesses.
Long-term care, exactly. So even if
Okay.
you got that question, you thought, oh my gosh, I don't even know what a minimum data set is. Think about what chapter we're in. Think about what the topic, the concept we're covering. What is close? Long-term care. All right. And then the last one, number 10. One goal of the home care for the chronically ill is to what?
Is it C, keep the patient as well and independent as possible?
That is correct. And why is that the answer?
Because when you are chronically ill, most of the time there's no like cure, but you're just trying to make sure they are comfortable as possible
Exactly.
throughout their care.
Mhm. Right. And we want them, if they want to remain at home, we want to do everything for them to try and have them remain at home, correct? Because where are patients most comfortable being cared for?
At home.
At home, right? So we try and have them as independent as possible so that they can remain at home. Okay, so that's your chapter 9. So don't panic if you didn't know the answers to these. It just the intention of doing this is to give you to see where your knowledge base is with this particular chapter. So if you did the readings and read the notes, then you probably did okay in this. If you didn't, it just means you need to go back and review it. Okay. So that was chapter 9. Chapter 18, there were two topics we discussed in chapter 8.3. One was peripheral artery disease, one was chronic venous insufficiency, and the other one was hypertension. Okay, so those were 3 topics that were on your readings. So I pulled out the questions. There weren't any questions with there were hypertension questions on this pretest. So let's see how we do on that. So this just gives you an indication of, where you need to focus your studies on. So what's the answer number 1?
C.
Pardon me?
C.
C?
Yeah, C.
Nope, C is not the right answer. C is actually a symptom of hypertension.
B.
B is in boy or D is in dog?
D is in dog.
D.
Correct. Yep. D is the correct answer. What about number 2?
Is it B?
B is in boy?
Yeah.
Yep. Okay. That's something you definitely need to know. Okay. And then what about number 3? Diuretics are typically part of the plan for treatment of hypertension. What do we need to know about diuretics?
Shouldn't they be taken
In
in
the
the
morning.
morning?
In the
Why?
morning.
In the
Why?
morning, because they're gonna be
'Cause you urinate.
urinating a lot.
Yep. Okay, great. So those are the 3 questions. The rest of the questions were part of the chapters that you weren't expected to cover. That's why I just pulled out these. Okay. 37. Okay. Have you guys gone through diabetes yet in MedSurg? You guys covered diabetes?
Yes.
Okay, well, it comes up in this week. So let's see how we do. And from your readings, it was the whole chapter. It was chapter, let's see, 882 to 902, which was basically the whole chapter. So let's see how you do with diabetes. What is type 1 formerly known as?
B.
Pardon me?
A. It's A.
It is A.
Oh,
Everybody see that? Okay, what about number 2? Okay, remember we have 2 types of diabetes. Type 1, which is insulin dependent. And we go through this in the notes, and type 2.
B.
So what's number 2?
It's C.
C.
Everybody know why that's C?
Because it's gestational. You know, you can
It's type 2.
yeah, you can get it from like being overweight,
Mhm,
your eating habits, your dietary.
mhm. Okay. What are some classic signs and symptoms of type 1 and type 2?
B.
Okay, you quickly, okay, explain why it's B.
Our teacher just taught us the 3 P's: the polydipsia, the extreme thirst, the extreme urine, and the extreme I forgot what phasia means, but she taught us the 3 P's to remember that those are characteristics of both diabetes type 1 and type 2.
You guys all hear that? It's a perfect answer. That's what my group said yesterday. The 3 P's. Okay. Anybody know what the recommended amount of carbs are? $55 to $60. Okay, 55 to 60. Okay, for a patient experiencing hypoglycemia or a hypoglycemic reaction to insulin, what do you do if the patient can't swallow?
A.
Is A.
Okay, the answer is D.
It says if they can swallow. You said can't
Oh,
swallow.
I'm sorry. I'm sorry. Sorry. So what do you do if they can swallow? Sorry.
Then it's D. Yeah.
Then it's D, right? You want to get them some sugar, some orange juice. Okay. Which insulin is considered fast acting? Guys should know that. They definitely know this. Humalog.
Is then okay.
Okay. Humalog is the fast acting. So again, if some of these questions are unfamiliar to you, that means you need to go back and read your chapter on diabetes. Okay, and I'll tell you there's I think 4 or 5 questions on the exam regarding diabetes. So, okay, which oral hypoglycemic must be given to patients who have an allergy to sulfur drugs? Okay, it's this one. What percentage of patients with diabetes might be affected by some kind of neuropathy? We don't need to worry about that question. We'll keep going. What's functional hypoglycemia? What might that be an early sign of?
Oh, retinopathy.
Cardiovascular disease.
Yes, yes. Number C, correct. And then last question, diabetes occurs. What organ is not functioning properly?
Pancreas.
Pancreas.
Okay, awesome. Okay. And then last chapter I want to go over real quick is it's your first reading. Okay, it's chapter 5, care of post-op surgical patients. Okay, that is page 83 to 99, which is pretty much the chapter. Okay, so let's go through your knowledge on this. Okay. So we're talking
So the first one
about
would be
first one's what? First one's
B.
C.
I think it's C. I've read a little of that chapter.
Oh,
It's C.
yeah.
Yep. How often do you do assessments?
Every 2 hours.
No, remember you're in the PACU. You're in the
Every
Package.
30.
Every
P.
15.
every 15. Okay. How do you well, you guys can read number 3. I don't need to read it for you. Go ahead.
B.
No, B is APGAR. What's that for?
That's for babies, right?
That's for a baby.
It's for babies.
Is
So
it
you
C?
can- It is A.
A? No, okay.
Okay. Why do I have this green line in the middle of my screen? Okay, go ahead with number 4. And what's the key word in this question? Spring loaded. So this talks about drains. Okay, a spring loaded collection drum is a hemovac. Okay. So you get a post-op patient who's feeling nauseous. What else might you do for the patient besides antiemetics?
That's D.
Oh. Did
You
you
said
say
nope.
D? Did you say D?
Is
D
it D?
as in dog.
Yeah, D's the right answer. Yep. Everybody see why that's correct?
Yeah.
Okay. Let's see if you can figure this one out. I had a student who went through the whole formula yesterday. What's the right answer here? Remember, it's ice chips. Who can talk us through this? Daria, she's working on it. Anybody know how to figure this out?
So is ice chips less than regular mLs?
Yeah. Would you learn how many is ice chips accounted for?
I guess
Isn't it half the amount?
Half.
half
Some
ml.
half.
D.
Somebody said half. Yep. So how many ounces is in a cup?
8.
So you have a cup and a half.
Yep.
12.
240 milliliters and divided that by half, which is 120. And then they got a half a cup. So then that'll be 60. So the answer will be B.
Answer's 180. Redo your math, but you talked it through exactly how it's supposed to be done. Your math is just off.
Yeah, no, it's not off. I said B. B as in boy. 180.
Oh, yeah. So did everybody get that? Daria did that perfectly. Did everybody understand how she did it?
Yes.
Okay. The other two answers are on the next page.
Can you go back up to number 6 and explain how she did that math?
Daria is going to explain it to you. Daria, go ahead.
For ice chips, it's half a ml instead of a full ml. So
Daria, you cut out, or did I cut out?
No, that was her. She's frozen. But I
Okay.
got what she was saying.
Did you get it? Who's asked? Did you guys hear her? For who just requested that she go through it?
I did, Latrice.
Latrice. Okay. So did you understand what she said?
She said it's half of an ml due to it being ice chips.
Yep. Okay. Daria, can you hear us? Okay, does somebody else want to talk through it? To Latrice. And somebody else go through the formula, please.
Are you able to?
No, I want another student to. Go ahead, because I want to make sure you guys understand it. Okay. Okay, so half, she already said half, Latrice. So 1.5 cup, how many ounces are in a cup?
30.
Nope.
8.
Somebody want to help Latrice?
8 ounces. And then you
Go ahead. Somebody explain this, please. Somebody else needs to understand this to explain this. Go ahead. Anybody else want to take a stab at it? Okay, so Latrice, where are you? So you have 1.5 cups of ice. How many ounces is that? Latrice, can you hear me?
What'd you say?
I said, how many ounces is 1.5 cups of ice? Because you're asking how to solve this question.
And it says it's 12.
Okay. And then what do we do?
I don't know. That's why I was asking you.
Okay, so we do the 12. Is Daria back? So what do we do next? We do the 12.
yes, I'm back.
Okay, go ahead. Explain this to Latrice, please.
Okay, Latrice, a full cup is 240 mLs. So ice chips are half of a ml. So then that'll be 120 mLs for the full cup of ice chips. The patient is getting 1.5 cups of ice. So that would be 120 plus the half, which is 60. So then you add those two together and you get 180 mLs. Ice chips is not the full amount of a whole cup of water. Like a whole cup of water is 240. A cup of ice is 120.
Okay.
So,
Latrice, did you get that? Awesome. Okay. What's the answer to number 7? The answer is D, 4 weeks. Okay, what about 8? A few more questions. When planning a diet to promote wound healing, we should be taking vitamin C. What is vitamin C? What's in vitamin? Which food here has vitamin C in it?
The collard greens.
Yep.
D.
Yep. Number 9. Post-op patient has hiccups. Which intervention may help with that? Answer C. Breathe into a plastic bag. Okay. Deeply 10 times. And what about number 10? Subjective complaints associated with wound infection. What might that be? What's the important word in the question?
Subjective.
Thank you.
Subjective.
So,
So-
so
B.
what's the answer?
B.
Nausea.
Yep, B is the right answer. Okay. Helpful to go through these?
I have a
Yeah.
question, Miss Marvel, on
Yeah.
one of the question things we just went over.
Go ahead.
How did you know it was 4 weeks for the wound to heal into a scar if we don't know what kind of wound it is? Or like how deep it is or anything like that? Is that just like a general rule of thumb?
That's a
or-
general rule of thumb, right?
Okay.
And of course, it will go out, extend out if they're more severe wounds, right?
Mm-hmm.
Okay. All right, so let's review your week 8 notes. Home health. Okay. We already talked about part of this, which is clients want to be treated for in their home. They want to be treated in their home. Okay. What do we do? What do home health nurses do? Teach, training. Okay. What else do we do? What do home health nurses do? Wound care, teaching, training, maybe teaching family members how to give injections. What else do home health care nurses do?
Just to provide assistance to the patient.
Okay. What else?
They help them with their medicine regimen.
Yeah. Mhm. They do all kinds of assessments. What kind of assessments do they do in the home? They do safety assessments, right? What else? Maybe environmental assessments, physical assessments, family dynamic assessments, right? What's a case manager? We've talked about this before. Nurses, we're going to find ourselves as case managers for lots of situations. What does it mean?
Right, case manager is basically a person that's behind to gather the information needed to take care of a patient. Like as
Yep.
far as different nursing homes, if they have to go to different rehabilitation units and stuff like that.
Yep, they're the coordinator of care. That's exactly right. Okay. A lot of big facilities have a case management team that works on all those things, right? But a case manager is the coordinator of care. You may be, if somebody's being discharged to a nursing home or being discharged home, what services do they need? Do they need oxygen? Do they need medical equipment? Do they need PT? Do they need OT? Okay, so you're doing that through referrals, education, you're communicating with the whole team, right? To identify what services are needed. And then the case manager coordinates that care. Okay. Why is it important for community nurses to to know what resources are available in the community.
So they can give information to people of that area or who may be needing it or requiring to get out information.
Yeah. So community nurses need to be a really kind of a knowledge bank of resources in their community. I know, for example, when I was in school nursing, we had a whole booklet in our clinics in the schools of who to call for what. Do we need to call poison control? Do we need to call the health department? Did we need to a local food bank? Did we need housing services, WIC program? We had all that right in the clinics of the schools so that we could let families with different needs know what was available in their community. Okay, so we know that community resources help. The attempt is to try and help reduce vulnerability. Right? Here's some other examples. Volunteer organizations, Meals on Wheels, food clothing banks, maybe crisis pregnancy centers, domestic violence abuse shelters. Okay. So important for us to be well educated in the community resources. Okay. And so the rest of this is a review of what we just covered, or what those questions just covered. So here's your post-op, okay, which was chapter 5. Okay, if you're taking notes, that was chapter 5. What's the most important component of post-op care? Your ABCs, right? ABC, safety and pain. What are some potential complications of post-op care? That's in your reading. How do you do a post-op assessment? Okay, that's in your reading. Okay. What are some of the things you're looking for? Pneumonia, emboli, respiratory depression from pain or anesthesia. Okay. So here's some issues. Potential complications are all here. Okay. And it goes through your ADPI. How do you do an assessment? Or what's part of your assessment? It's part of your assessment in a post-op patient. Tells you right here. Okay. With your planning, how do you prevent complications? Your information is right here. Using aseptic technique, change in dressings, turn, cough, deep breathe, incentive spirometry. Okay. Here's another question. What effects does tobacco have on post-op care? You think it delays healing?
Yes, it definitely does.
Okay. So those just some cheat sheet notes on your med-surg, but please go back and do the reading. And then here's our cirrhosis. All right, what are some common causes of cirrhosis? There's 3 of them. Have you guys studied cirrhosis in med-surg? I can only see a few people and they don't have their cameras on. So have you guys studied cirrhosis in med-surg? Can somebody please answer me?
I want to say
Yes, I think so.
Okay. All right. One of the things that we need to know is what a cirrhosis patient client might present with. Okay. Fatigue, weakness, headache, anorexia, indigestion, abdominal pain, nausea, vomiting. Okay. What are they at high risk for? Right? They're at high risk for bleeding and bruising from what? Their vitamin K deficiency. All right. So pruritus is common due to the buildup of toxins. Jaundice, we talked about that. Okay. And interesting, elevations in liver enzymes usually do not occur until 65% of the liver function's gone. Okay. And here we have, look at figure 30.3 in your med surg book, page 726. Okay, that's right in the middle of your reading. What are your interventions for cirrhosis? Here they are here. That's why you had the diuretic question in the pretest. Certainly follow precautions. And here was the other question, right? Interventions, daily weights and abdominal girth. Okay. Next topic was COPD. Okay. Have a look at this section. What is COPD? I assume you guys have studied COPD in med-surg, right?
Yes, we have.
Okay. So that would be a review. And then here's your diabetes. Okay. Okay, so we talked about the difference between type 1 and type 2. What might a client present with that potentially is going to be diagnosed with diabetes? What might they present with?
You for like developing type 2 diabetes?
Or just in general, it's the 3 Ps. Recurrent infections, poor wound healing, initial weight loss. Saw a lot of that in the schools. The kids had significant weight loss. That was a key factor. Unexplained weight loss. Okay. So have a look at that section. Peripheral artery disease. Here's your pages, 416 through 420. That's in your readings. Okay. What is it? I mean, I hope you've studied some of these issues in your med surg class. So go ahead, Tasha. Go ahead.
I'll just say it's like where there's some type of deficiency of the flow of blood to like your extremities.
Exactly. Right. That's exactly right. And it typically affects your lower extremities, which is why it's called peripheral. Okay. What do you do with clients with peripheral artery disease? Okay. Here's your interventions. Walking improves circulation. Smoking cessation if they smoke. Okay. Keep your lower extremities below your heart, below the level of the heart to improve circulation. And then what's chronic venous insufficiency? Okay. Do we know what the anatomy and physiology is of that? Valves in the veins don't close normally, preventing venous blood return out of the extremities back to the heart. Okay. What are some interventions for that? Okay. And hypertension, we covered that. What is, so typical blood pressure is what?
Is it 120 or 130 over 80?
Which one? 120.
120 over 80.
120 over 80?
Mm-hmm. Mm-hmm. And what happens if you're, it's between 120 and 130? What happens if the diastolic is between 120 and 130? Does that automatically maybe need medication, or can you maybe work on diet and exercise?
You can
work on
diet and exercise.
And then once it gets above 130, that's when it becomes an issue. When we look at medications, okay? What contributes to hypertension, age, some ethnicities, family history. Okay, and other things. What's the intervention? Okay, so it gives you some interventions. I know you've studied this in med-surg, right? Decreased sodium diet, advocating routine exercise and dietary changes. Okay, and here's your box 18.1 on page 410, talks about the different medications, and it talks about your diuretics, which we had a pre-test question on diuretics. Okay. So your week 8 notes are really quite, your week 8 notes are very much on target for the content we're covering. They really are. Does anybody have any questions?
Are you sharing those notes with us? The PowerPoint?
Yeah, you should get them every week.
Okay, thank
Yep.
you.
Yep, they're all in your announcements. Yep. Yep, that's what you should be using to study. And then Dr. Kershaw and I are working on an exam 3 study guide as well.
And this will be put up for recording so we can go back and
Yeah,
look at.
it's recording. The whole class is recording. Yep, yep.
You
So
send those pre-tests? Or are we
I
not
can't
allowed to
send
have
I
those?
can't send those, but they're on the recording.
Okay.
All right. Were the pre-tests helpful prior to looking at the notes?
They was, for me it was.
Okay, good. Good. So you got your pre-test and you've got your notes. So let's see. This week, post-op care, cirrhosis, diabetes, hypertension, chronic illness and rehab, and then our peripheral artery and our chronic venous insufficiency are the topics that were covered this week. Okay. Okay, let's do our, first of all, I need everybody to make sure that they are in the chat, right? For attendance purposes. Okay. Let's do some presentations. Let's see. I have Tasha here. Let's do our alpha group first. So Ashley, is Ashley here? Yep, there she is. Ashley and Tasha. You guys did hepatitis, correct?
Yes, we did.
So tell me about your project.
We had to go through and basically break down the different types of hepatitis.
Okay.
You have A, B, C, D, and E.
Okay.
And we had to tell, like, the genetics of it, what problems it caused, interventions, all that.
What's the most common of all the types of hepatitis?
The most common ones is A and E.
Okay. And how is it transmitted?
Well, A and E is oral transmission through like fecal matter from like food that's been contaminated, water, even coming in contact with somebody else that may have it.
Yeah. Okay. Ashley, how do you treat it? Ashley? Ashley, are you there? Ashley, can you hear me?
I don't think she can hear you.
Yeah. Okay. Is there any treatment for it, Tasha?
Well, for A&E, mainly treatments is that you just it basically goes away on its own. They do have some vaccines for it that they just recently developed, but with A&E, if you can treat it symptomatically, like if you have any, nausea or something like that, you can take Zofran. But for mainly, it just goes away on its own.
Okay. And do we think that any kind of hepatitis this is for everybody? Do we think that any kind of hepatitis is reportable to the health department?
Yes.
Absolutely. Absolutely. Okay. Ashley, can you hear me yet? Obviously she can't. Okay. Do you guys have any questions for Tasha? Did you learn a lot, Tasha?
Good job, Tasha.
Thank you. Actually, I did. Like when I was looking up, me and Ashley did it together and we separated it. But to look it up and see like when it initially like came into play for, it came out like in 1812 with an outbreak occurring in the United States. But before then, it had an outbreak in the 17th century, but we didn't know a whole lot of information about it. And it wasn't in the United States. It was like mainly across seas. So it wasn't like, and that was before the CDC and all those different organizations were created. So it was no tracking of it. So when it got to the United States, then that's when they really started tracking it and finding out how it was developing and the causations of it and the different types, like the A, the B, the C,
Great. Great. Anybody have any questions for Tasha? Awesome. Awesome job. Great job.
Thank you.
Yeah, great job. Fantastic.
It was very informative. I really liked it. I mean, I learned about it in class and everything, but after I started doing more in-depth research, it was very informative.
Oh, good, good. Well, that's the purpose. That's the purpose of a project like this. Ashley, can you hear us yet? Okay, let's go to our Bravo group. Let's see. I have Ariel. I don't know. Ariel's here. Latrice is here. And Lamik is here. Right? See Ariel. Student, that's Latrice, right? Latrice. And then Lamika. Where's Lamika? Did she go away? Okay. So Ariel and Latrice, tell us about HIV and AIDS.
HIV was discovered in the 1980s. They didn't have a name for it around that time.
Okay.
It is most common in males, sex females, and bisexual, gays, bisexuals.
Okay.
People who share needles, who have contact with blood or any type of bodily fluid during sexual contact.
Okay.
It can happen from a child can get it from their mother. Signs and symptoms are like flu-like symptoms, sore throat, fever, fatigue. HIV progresses to AIDS if untreated. It affects the immune system. It can cause you to become very ill and susceptible to many infections.
Okay. Ariel, is there any treatment?
Yeah, you can do treatment, but there is no cure.
What kinds of treatments are options?
So you can give them medications. Hold on, I'm trying to find it in my paper. There's
That's
like
okay.
back in I think 2019, they just approved of 50 different medications that people can take to help treat and improve symptoms of HIV and AIDS.
And there are probably a lot of antivirals.
Yes.
Yes, you would take antiretrovirals. They also have stem cell based gene therapy, Bradley, neutralizing antibodies, which is a rare type of antibody that works to kill off most of the HIV variants administered through vaccine.
Okay. Okay, great.
And the CDC recommendations would be HIV testing, surveillance, person with HIV, preventative care, program management, and preventing new infections.
Right. Excellent.
Yeah. And this population, they go through widespread discrimination, stigma, and violence. There's a lack of access to HIV services with this disease. You would need treatment and medications for the rest of your life. And it's very costly. So people that don't have insurance, it's really hard to medicate them, or low poverty levels, stuff like that. They could apply for. Sorry.
Go ahead.
They could apply for the government like insurance, but not everybody gets approved, so it can be hard for people.
Absolutely. Did you guys learn a lot doing some research?
It actually used to be called GRID, GRID, which stands for gay related immunodeficiencies.
Oh, I did not know that.
1980s. Yep.
Did anybody know that?
No, I didn't know that.
I didn't know that. Wow.
And then later they found that it was a part of the chimpanzees, like hunting them, and the hunters got it and it spread, stuff like that.
Yeah, it was very it was in the 1980s. I remember that in nursing school.
Yeah.
Great. Do we have anybody have any questions for the ladies? Fabulous job.
I know. Great job, girls.
Thank
you.
you.
Fabulous job. Okay, let's go to our Charlie group that did whooping cough. That would be, well, I only have Terry here. Did Terry stay on or did she get off? Okay, so we don't have anybody representing that group. Okay. So let's go to our Delta group, which did Ebola. That would be, I think everybody's here. Marissa, I saw Marissa, Selena, I saw Selena, Daria. Daria's here. Is Daria here? Okay, I thought Daria was here.
Yes, I'm here.
Oh, where are you? There you are. Oh, there you are. Oh, you're our math wizard. So you guys did Ebola. Tell us about Ebola. Anybody can
Hopefully
talk.
it don't turn out to be our next pandemic.
Yeah, isn't that the truth? What is it? What is Ebola?
I don't know. It's like almost like a viral infection, but it's just like a lot of stuff. Like it can be contracted from animal. Some were saying it was like in bats and stuff like that.
Mhm.
So
Selena, how is it transmitted in any particular way? Or what's transmission?
It's mostly the way most people were getting it was like through contact with the fluids.
Mm-hmm.
And I mostly did my part of it on like surveillance. So I
So
guess
tell us about that.
Originally, like when it first came about, they were only tracking it through like word of mouth and then like a paper trail.
Mm-hmm.
But eventually it got so bad and it started to spread more and like across the world. So obviously they couldn't do word of mouth and paper trail anymore. And
Sure.
someone made an app for it. So every time someone had a confirmed case of Ebola, what they would do is they would download the app, and in the app they would go and like I guess mark themselves. It was kind of confusing. They would mark themselves off and say that they did have Ebola, and that's how they started to track it through like countries and all the villages and stuff,
Mhm.
because some places had better access to communication than others.
Yeah. Where did it start? Where wasn't it over? Where was it? It was which continent? I remember because it ended up coming to the United States, and I was trying to think of with the group yesterday. I remember I thought it was a case or a couple of cases in Texas. You guys remember that when we had the Ebola scare here in the States?
I know a lot of it was mostly in
somebody from overseas.
What now?
overseas.
Yeah, but it
It was a
did
lot more.
come here to the United States.
It started in like Congo or something.
Yeah.
Congo. Okay. Okay. Marissa, what treatment? Are there any treatments?
Yeah. Oh, there's a
Well, what part did
vaccine.
you do? What did you
I
do?
did the attempt to control transmission.
Okay, so tell us about that.
It came from the Republic.
Okay. Marissa, tell us about transmission.
The transmission is through the fluids and the raw meat of bats and like forest antelope and some monkeys that are affected with it. And there is a FDA approved vaccine.
Okay. Wow. What else do you want to tell us about? Any of you ladies want to tell us about Ebola?
You can
Scary.
also get it through like sex fluids too.
Oh, okay. I did not know that. What questions do you have for these ladies? Excellent, excellent job. Really good job. Very informative. Okay, let's go to our last group, our echo group, who did the flu. That's Hannah. Jenny is here. Denisha's here. I'm noticing Denisha and Morgan. All four of you guys are here. Tell us what we don't already know about the flu. What is the flu?
So I did like how the flu's transmitted. Like
So
the
tell us
very
about that.
first little thing. It's transmitted through droplets from people sneezing and coughing, kind of similar to COVID. And it can spread from one person to another, like with a 6 feet distance. The droplets are inhaled into the lungs, and the flu can spread also by touching surfaces that have the flu virus on them. I found that the CDC has found that young children and older adults with weakened immune systems could infect others with the flu virus for an even longer period of time. Like it stays in their body longer.
Sure.
Yeah. And then, sorry, I'm just looking over
No,
the paper. And then just like basic stuff like holding laundry prior to washing it can cause transmission if you like hug the laundry. So you like hold it close to your body. So it's better if you like hold it further out and then like wash your hands and stuff like that. That soap and water work really well, but if that's not available, hand sanitizers work too. And then I found over the age of 6 months, they can get a flu shot, which can help reduce the risk of contracting the illness and lowering the risk of being really ill and needing hospitalization.
Yeah. Great. Awesome. Jenny, what part did you do?
I did ways that we try to control the transmission. And
Okay.
basically what I said, the flu is a lot like COVID-19. So I think we take the same precautions by getting the immunization. If you're sick, stay home. If you're around someone with the flu, stay away from them. Like keep a distance. Let me pull up my paper and what I put. I also put that the immunization is available in like a nasal spray and also the injection, but the nasal spray isn't recommended for children under the age of 2 and adults older than 50 and women who are pregnant.
I did not know that. Okay.
That's about all that I got.
Great. Awesome. Morgan, what part did you do?
Another one about surveillance. Can you connect my phone? You might have to hear me from my laptop.
Oh,
My
yeah,
internet's
yeah,
not
yeah.
good.
I tend to not look at that once I get started. So I just connected you in. There you
Okay,
are.
can you hear me better?
Yep, that's perfect. What part did you do, Morgan?
I did the one on the type of surveillance.
Okay.
So for the type of surveillance, it just basically said they use indicators from like the hospitalizations, that get hospitalized for it, outpatient things, the percentage of deaths that result from flu. And it also said that when I researched it, said that they do understand of the flu viruses, so they can know the different strands and you know how each year the vaccination changes the strain. I'm sorry. Here. And then it also said, oh no, well that's basically it. Yeah. So
that's great.
Some different populations based on like their age and their underlying medical conditions and things.
Sure. I was fine with the, I don't know about you guys, but every time I get the flu vaccine, because you're in healthcare, you're encouraged to get it, but find that every time I get the flu vaccine, I get sick with the flu.
I've never got
Anybody else?
Me
That
too.
happened to anybody else?
Every time I take it, I get sick.
Who said that?
Me, Tasha.
Tasha, every time I take it, I get sick. So do I.
I've never.
What?
I said I've never got sick getting the flu vaccine.
Denisha, what part did you do?
Well, I did the treatment part.
Okay.
And I basically said that you could either go the traditional home remedy route, or you could just do the traditional medicine route. For the seriously ill, they'll be prescribed an antiviral drug such as Tamiflu, Relenza, or Rapivac. But Tamiflu is one of the most recommended medicines for influenza, and it's available in pill or liquid form. And it can also be given in infants as young as 2 weeks old. It says that the antiviral should start to work in less than flu symptoms within 2 days. And if you wanted to go the home remedy route, you could basically use like ginger or garlic and stuff like that, and do little mixed drinks to boost the immune system. And the best way to reduce the risk of getting the flu is to get the influenza vaccine which will protect you from getting it. In some cases, reduce the symptoms even if you are infected.
Yeah.
And that's basically all I have.
That's great. Wow. Did you guys, I mean, I know the flu's common and stuff, but did you guys learn anything new?
Yes, ma'am.
I just learned a few things.
Yes, ma'am.
Morgan, was it helpful exercise for you?
Yeah, I think it was. Yeah. I mean,
Yeah.
about the helps to
Yeah.
know. Always learn something.
How about Hannah and Jenny? Good exercise for you?
Yeah.
I think I already knew a lot about the flu because it's so common,
Yeah.
but it helped me learn about the nasal spray. Like I never knew about that.
Mm-hmm.
Yeah, I learned it's very similar to COVID, like how it spreads and stuff like that.
Good. So who did treatment? How am I supposed to feel better if it's like COVID? Anybody have who did treatment? I'm halfway joking, but I had COVID, 3 weeks ago, and I'm still.
Oh, I did too. I got it like a couple weeks ago and it sucked. It was not fun.
Well, this is my third time getting it. And the same thing happened to me in December. I got really sick in December over the holidays, but it just took forever to feel better, almost like another 2 months. And I think the same thing is happening. Just the fatigue and the headaches. It's like, I just want to feel better.
Yeah,
So anyway, Terry, did Terry get back in here? I saw Terry. She's been in and out. Wanted to see if she wanted to do her presentation, but I don't see her. So
I saw the text on the chat.
Something about the volume. Yeah. Okay. Well, I hope this was a helpful exercise. It was about learning a little bit more about a specific infectious disease, but the other part of this assignment was working in a group. Okay. As nurses, we're always going to be working in groups and teams, right? And it maybe just be you and another person, but you're always going to be communicating with the nurses, the doctors, the x-ray techs, pharmacy, whatever. You're always going to be communicating with people, right? That's part of what we do in nursing, right? So what's important in group dynamics? What works? What kind of skills do you need to have for effective group dynamics?
You got to have good, you got to be able to talk to, get good communication, correlate what you're going to do. Like me and Ashley, I enjoyed working that project with her. We worked together on it.
Okay.
We both gave each other feedback on what we was doing, and
great.
It worked out fine.
Awesome. That's great. What are some other characteristics of good group dynamics? How about listening? Listening to the others, knowing that others may have a different point of view. Right? What else is important? You already said it, feedback. Being able to give honest, constructive, participation, active listening. Yeah. Turning in on time. So punctuality, if you're expected to have a paper that's due today, it should be due today. Kind of like if you're trying to work with a team, or let's say a respiratory therapist, trying to coordinate them doing a visit. And the order was for noon today for the respiratory therapist to visit. Does she need to be there? Right? So, just think about the clinical setting, all right? Deadlines, planning, think about the nursing process, planning, carrying out, put the nursing process into this paper. You already know what you need to do, right? You're planning how you're going to get it done, implementing, writing the paper, evaluation, your grade. So, right? Does that make sense? What doesn't work with group dynamics? What barriers are there?
People that don't They want to take control, as some people are, they are control oriented, or for better words, and they always feel like they need to be in charge, and they're not willing to take any feedback or instructions from their teammates. That can cause a lot of problems in the dynamic.
Yeah. What else? Excellent. Yeah, excellent. What else? Maybe judgmental. Not a good listen, not listening. And so the last question I have is, what do you do? What do you do when the group is dysfunctional, or one member is not pulling their weight, or one member's trying to control everything? And what do you guys do? What do you do? What are you trying to do?
Well, you can try to talk to them, but if you can't reason with them, I guess you just have to do your own thing and just let them be, I guess.
Right. Yeah. And if you're working in a clinical setting and, trying to resolve it on your own with constructive feedback, that's fine. But then you'd have to go one step above. I've tried this, I've tried, when groups come to me, or people come to me during these group activities with concerns about another teammate, I always say, have you first tried to talk to the teammate? Right? Because as nurses, we're problem solving our whole career. Are we not always problem solving? Right? So the purpose of this exercise was just the importance of group dynamics. If it's working great, that's great. But if it's not working great, got to figure out how to change course. Okay. So hopefully this was a helpful exercise for all of you. Certainly from what I've seen so far, I'll finish the grading today. What I've seen so far, they're great papers, PowerPoints, great. And it's really nice to hear from everybody about what your involvement was. So does anybody have any questions? I know it's only 9:30, or excuse me, 10:30. So we can do our attestation now. And then if you wouldn't mind using the extra time to go in and do quiz 5 and get that over with. Okay. So you do your attestation in your quiz. That'd be great. And then you're kind of done with community, not done, but you've done your 2 assignments for the week.
I have a question. Is homework still turned on for included in our overall grade, or did you turn the homework off?
Oh, Lamika, I sent a message in the announcements. I turned it back on again.
Oh, okay. I just seen where you were turning it off, but I noticed my score didn't change, so I'm like,
no, I sent an announcement.
Okay.
Dean Brown asked us to turn them all back on for one more week. Apparently there was lots of students that were lacking in homework. We don't really have that issue in this class. So she asked us to turn them back on again. So they're back on, and I sent an announcement about that. So your attestation is today, the 30th. Can you believe that Thursday, September 1st? Ooh, where'd the summer go? So attestation the 30th with me, and then that's it for me. If you guys have any questions, I'll stay on. But maybe go do your quiz and get that done. I hope everybody has a really great rest of the week, and please reach out if you need anything, okay?